Hey, Joe Zarzaur here with Dr. Evan Malone. As you know, Dr. Malone is a board-certified internal medicine physician. We're here for another installment of Zarzaur Law TV, but we have a special edition today, and today we're talking about the coronavirus, COVID, is that what it is?
Yep.
COVID-19?
Yep. Mm-hmm. Because it's a 2019 virus, that's why I got the 19.
I didn't know that.
Even though we're in 20, it was from 19.
Right. All right. So, of course, everybody's paying attention to this now. The stock market's paying attention to it. It had a drastic drop today, in addition to the oil price issue. But long and short of it is people are afraid. And we had a case here in Santa Rosa County, and the person passed away at Baptist Hospital right up the street from here. And so I wanted to get Dr. Malone, I asked him today to call around, find out what the current landscape locally is for qualifications for testing, and then what to do. Obviously, you probably heard this 100 times, but what to do to prevent being susceptible to this virus. So Dr. Malone, tell us what you found out today in calling around to the local places. Number
one is, if you think that you have been exposed, you're symptomatic, you traveled somewhere where it's an endemic area, the first thing you should do is call. Okay, don't call 911. Don't race to your doctor's office. Call ahead. A phone triage is the best way that they can handle what you need, as well as keeping everybody else safe, healthy, unexposed. Okay, right. So it's counterintuitive. They always say, "Oh yeah, just if you're having whatever symptoms, go to your doctor's office." But call ahead. What
if somebody's having bronchitis type symptoms, or fever, and they have a cough? Are they supposed to call? Or?
No, I mean, if you're in extremis and you're calling 911 because of that, then yeah, you're supposed to try and communicate that or one of your loved ones, someone who's with you, say, listen, they're short of breath, they're in respiratory distress, and they're not acting themselves. And by the way, they just got back from wherever on some trip. Then yeah, that's the best way they can do it. But if you're having mild symptoms, as I would call them, let's say you're younger and healthier to begin with, and your mild symptoms, you should probably call your doctor anyhow. And so what's going on is more or less phone triage, and your doctor needs to be the one to either communicate with the Department of Health here, it'd be Escambia County, and again, wherever you live locally that have their own setup, and they would communicate with them that, hey, I have a symptomatic patient, here's the demographics, and I'm going to order the test. Because it's not like if you go to your doctor's office and you order a blood count, the Department of Health does not care about your results ever on those things. On this one, they want right. to follow that. So they will then track you, and they're involved in, I guess, your outcome, if you will. So then if you need more than just symptomatic relief, if you have some other decompensated illness, let's say you're dehydrated and like you said, you got bronchitis, then at that point, they're gonna alert someone, hey, this person's coming in and you need to have them in isolation. It's a negative isolation so that you're the only one that's keeping yourself sick, and you're not getting all the hospital workers sick as well.
All right. So, how does somebody know whether they should call instead of going to their primary doctor for flu symptoms? I mean, yeah, because more times than not, or most of the time, they're not going to have this virus. So, how does somebody supposed to know whether they need to isolate themselves and call first, or is there a risk group? Just you said if they've traveled internationally, but there's some people getting this virus from community, what do they call it? Acquired communally based, right?
Yeah.
How does somebody acquire the virus who has not gone on any international trips or otherwise been exposed to it?
Well, if they've been in a group of people where they knowingly know that someone has been traveling. So if you went and you had a business meeting and half the people from the meeting came from somewhere else, then it's like you were there. Okay, so if you have exposure to someone who's traveled, that'd be another one. So travel yourself, exposure to someone who's traveled, exposure to someone who is being tested as well, and currently they have a pending test, we don't know the result yet. Those are probably the top big three ones. But yeah, to your point, influenza season's going on, and guess what else just started here? Allergy season. Yep. And there's people that are complaining of allergies and they think that they have COVID.
And why is it that younger people aren't affected as much as older people?
That has a whole lot to do with the nature of your immune system, the medications you're on that may be affecting your immune system. Your breathing is probably the number one issue that people, that's not older even. You could be a 50-year-old with bad lungs, right, and it's going to treat you like an older person.
Right. So what is the test? Is it like a throat culture? Is it a nose culture?
They're doing swabs, nasal and the mouth, and they're doing saliva samples. So it's 3, and I guess it's so they don't get a false negative. where, hey, you're clear, you can go back in the community. So it's triple testing to make sure that they're not missing anything. The test, notably, is probably not going to be perfect. It's a new, novel test. So doing the 3 levels of testing, it's not a blood test, is what they're doing. And then in the meantime, you have to quarantine yourself. If you're having mild symptoms, then you're staying home and staying away from everybody. And anybody that has potentially had exposure to you are on higher alert, as we mentioned, to any symptoms they may have. What can you and I do, though?
Right.
Okay, so this is stuff that I try to do every day anyhow, and a little more vigilant in the influenza season. But surfaces, hand contact. One of the articles I read today says that the average American adult touches their face 23 times an hour.
Mine's 46. Easy.
He's ramped up.
Yeah.
But no, so touching your face, handshaking, so maybe you forego the pleasantries if you don't need to. And then, let's see, I brought a couple of props. Your hand sanitizer, which it's probably difficult to find right now.
Yeah.
A little bit more research today. Believe it or not, yes, you can use rubbing alcohol. It needs to be higher than 60%. Okay,
that, yep.
So greater than 60%.
No vodka.
Well,
vodka's
vodka's not 60%.
Yeah.
Everclear is. Everclear comes from 120 to 190.
Oh, that's right.
So you can do Everclear grain alcohol.
We prefer you not to do that.
Yeah. So anyhow, so the key with these things is rubbing alcohol and the sanitizers need to dry in your hands. The drying effect is the evaporation from the drying is what kills the cellular wall of the virus, if you will.
And then I read something, of course, washing your hand with soap is as effective.
Yep.
But most people miss the thumbs areas and then in between the fingers.
And right here.
And then right here where there's crinkles, where there's like the little, like the palm print, where there's like a little bit of a gap,
Yep.
where stuff can get in there and you don't necessarily wipe it hard enough to get inside the wrinkle in your hand.
Yep.
And so you need to scrub that area and on top and then the thumbs and in between the fingers.
So warm water and soap, not cold water, warm water. And one simple thing that they're telling like even grade school kids is say the ABCs when you're washing your hands, and you can stop when you're done saying the ABCs.
All right. I also heard happy birthday twice. All right. So
one more prop.
Oh yeah.
Keep your surfaces clean. So at work, your desk, phones, anything that other people may be touching. The FDA has an approved list of products that will kill the virus. So check that out. We have a link that we'll share with you, but get these while you can as well. And again, if you can't get these, rubbing alcohol on the surface of the desk will do the same.
All right, so I have a question.
Yep.
The people that are on cruise ships that get this, are they getting it from direct contact with the infected person, or is it coming through some kind of recirculated air potentially? How are people acquiring it on these cruise ships? What is happening?
Yes to both. From what I've seen in the reports that are available right now, they said that there was traces of it in some of the ductwork.
Oh.
It can live on metal for up to 9 hours.
Oh.
So it's like on a door handle, or so if you're in a cruise ship, a door handle, a handrail, whatever, if someone's walking down the hall.
So this is a stupid question, but if you're in a hospital and you've got one part of the hospital is dealing with the sick patients that have that, and then you've got the rest of the hospital, how are they keeping the air from circulating from those environments to the healthy environment?
So that's nothing new. That's how we've been dealing with suspected tuberculosis for years, which is airborne.
Okay.
So negative pressure room.
Okay.
So the hospitals are built this way, and some of their wings or rooms where it's a negative pressure, so that whenever the door opens up, it's sucking air out instead of bringing it in.
Okay.
So yeah, it's the negative pressure setting.
Okay. Very good. All right. If we have further questions, you can find us on the web, but we're going to have, more importantly, the links below for this video are going to be really important. We're going to have CDC and who else?
Well, locally we have the Department of Health for Florida as well as Escambia.
Right.
Escambia, then we have CDC, and then World Health Organization is good, although it's not as easy to digest, I would find. So that wouldn't be the first place I would start. And then lastly, the FDA listing of the different household
products.
Yeah. Mm-hmm.
Very good. All right. Y'all take care. Of course, if you have questions for us about any personal injury case, medical malpractice, car wreck, you can find us on the web at zarzaurlaw.com, or you can always call us at 855-HIRE-JOE. Thank y'all very much.